Caring for elderly patients is already demanding, but what happens when you add a whole new layer of complexity? Patients with brain injuries, trauma, or unpredictable behaviors because of adrenaline type of injuries. For nurses and caregivers, the challenges just feel a bit overwhelming. So behavioral health issues in senior care are becoming so much more complex. It's just not stress and burnout anymore that they are still dealing with, but nurses are adapting to new patients, those recovering from traumatic accidents, dealing with brain damage, or displaying adrenaline fueled behaviors. These situations require a new approach. And here's just a few ways that you can tackle it. So, the first one, reduce stigma around mental health. Rebranding your employee assistance program is something pretty simple, but you can, a creative name for this, which is more approachable, could be Care and Connect Network. There's a number of different things, ways that you can rebrand here, but providing accessible mental health resources. So on-site mental health professionals can support both staff and patients. So providing a psychologist that can be on-site, can be readily accessible, will improve things in this area. So train your leaders too. So mental health first aid equips managers to recognize signs of stress or burnout and guide employees to this self-service support or guided support. So creating safe spaces for learning too. Host panel events where nurses and staff can learn strategies for managing complex types of situations and patient behavior. So one senior care organization we worked with were faced with some of these similar challenges. Their nurses were feeling overwhelmed. Patients were feeling that their needs were unmet and engagement was just suffering. So by implementing these strategies, they saw a transformation. Awareness of mental health resources grew and utilization boosted for counseling services, increasing by 80%. And their caregivers just felt more empowered and were able to manage even the most complex issues. So these are just a few ways that you can start implementing these types of resources to deal with these big challenges, especially in senior care. But the challenges in senior care are real, but so are the solutions. Equip your team with the right support and the rise to meet every challenge. And if you're ready to make behavioral health a priority for your organization, we can make it happen together. We have a team. We can consult with you. We can provide self-service, even free resources that are ready for you guys today. So post a comment below. Let me know one thing that you're going to start implementing today, and would love to hear and see how we can potentially help too. We're here to support.